Okay, great. We're on. So uh, I'm really excited for tonight's webinar, but I'll turn it to Mark to welcome us from the clinic. Then I'm going to introduce our guest for tonight. So welcome, everyone.
Yes, yeah, a warm welcome to everybody. Can you hear me okay?
Yeah.
Okay, my voice sounds a bit weird in this microphone for some reason. Yeah, a warm welcome to Kaz and to everybody who's joined us on behalf of the Bill Nelms Pain and Research Center. Thank you so much for joining us tonight. Welcome to all our patients. I hope that tonight's session is another interesting and stimulating session. So I would just like to welcome Kaz. I'd also like to just take this opportunity to say to our patients, you can put things in the chat. Madeline will monitor that. We just ask, as per usual, that we're all respectful to one another, because that way people are comfortable, they can express themselves. And other than that, I'm going to turn over to Madeline to introduce Kaz. So thank you.
Great.
Thank you.
All right. Thank you. Yeah, I'm excited to have Kaz Kikuchi here with us tonight. We are wrapping up, almost wrapping up, a month of different topics, different webinars about movement. So I hope you've been enjoying it so far. So Kaz he's a Canadian trained, he's a physiotherapist who's local here in Kelowna at MoveMed Physiotherapy, which is where I found him when I was referred to MoveMed. He's trained in, raised in Japan, but trained actually at McGill University. I just realized that. Yeah. And has a very strong interest in chronic pain. And so when I went to MoveMed for my own pain, for my own issues, I realized that there was a PT there who had training in pain reprocessing therapy and also something called cognitive functional therapy. And this really piqued my interest because, I mean, some of you are familiar with pain reprocessing therapy and moving through fear of pain. But I also thought that combined with the work of a PT with movement, I got really curious about how this works. So really excited to have Kaz with us here tonight. And yeah, I'll try to keep an eye on the chat for any questions as we move along. So I'll hand it over to you, Kaz.
Okay. Well, first of all, thank you so much for having me. I'm so excited and I hope that I can add value to everyone participating in this the group. And I know you already heart is coming up.
Yeah.
I made some slide. So I'm gonna share some slide. But what we're going to do is, first of all, I have the 3 topics. So I'm going to do each one by one. And I think that I'm going to do some, like Q&A sessions between each topics so that, someone who had us questions and, forget about their questions. I do in the end, like a Q&A session. So if you have any questions, let me know. And so okay. I'm going to just share the slide. Let me share a slide.
Sure. So I'll keep an eye on the chat, and I'll just during the Q&A.
Yeah, that would be great. Or like if I'm gonna again stop the the slide as well, so that we can chit chat, and we're gonna move on to the second one as well.
Sounds good.
So able to see the slide?
Yeah.
Okay, perfect. So let's go. So now is moving through the field of pain. So I am a physiotherapist. So I'm going to quickly introduce myself. Orderly Madeline kindly introduce myself. But I am originally I'm born and raised in Japan. And I went to the university in Japan, the studying the physical education. And after that, 2009, I moved to Canada to get into the kind of like physio program. So after that, I got into the McGill University the physiotherapy program, and I spent about 3 years in Montreal. And after that, I wanted to come back to BC. So I picked the Kelowna. I didn't know anything about it, Kelowna, but like I picked the Kelowna because of the nice, my wife said that like, there's nice beach and nice mountains. Okay, I like running and I like beach, so let's do that. And I got into the KGH first as a first job in Kelowna. And I started working in the KGH and the mobile physio clinic to start. But through my connections, I find that I kind of like a movement physiotherapy. So I joined the movement physiotherapy, and I still work in the KGH, Corona General Hospital, and also the primary urgent care. And the last one is here is the running clinic Japan. This is one of my other passion is running, and that is educational organization that teach the healthcare professionals how to treat running injuries. So I go to Japan to teach the healthcare professionals how to treat the running injuries. However, this is not about running. This is a chronic pain. So I'm going to focus on the more chronic pain. This is one of my deep passion about how the treating the patient in chronic pain. So I have the additional trainings in the Madeline told everyone, but the pain reprocessing therapy, which is a very good. I learned a lot of the things chronic pain and how to treat, how to kind of like change the brain reprocessing the like pain, so using the kind of like lots of the different method. And also the cognitive functional therapy, which is the specific for the lower back pain, for the chronic lower back pain. And I'm a member of the Pain BC mentorship network for pain and mental health and substance use. So I do the monthly meeting with the other healthcare professional to how to treat, discussing how to treat chronic pain and the mental health and substance use. And the picture is my family. I have 2 kids and a wife, and I'm living in Kelowna, BC. And so this is the 3 objective today is today first one is how to move when fear arises. And so I want to learn what you can do when fear arises. And the second one is how to manage movement and exercise when flare-ups happens. And the last one is how a physiotherapist can help you with the emotion and the movement. So I'd like to ask the first question. So if you can answer, some in the chat, that would be great. I'd like to know who you are. So if you are healthcare professionals, I want you to put 1, or non-healthcare professionals, I want you to put 2. So if you can put that, that would be great. Can I see? Okay. Good.
And you could be
Okay.
1 and 2.
1 and 2. Yeah. That will be good. Or some random number is as well. Okay. Good. So good. Lots of like non-healthcare professions. Okay. And the second questions. Now, are you currently dealing with chronic pain? Yes, I want to change that. Like now is a letter. So like yes is A, no is B. Okay, lots of A, maybe C. Okay. Good. Okay.
Okay.
Okay. And the last one is, do you think that movement exercise is good for your chronic pain? You can type in yes, no, or maybe. Oh, okay, 100%. So everybody knows that the chronic, the movement exercise helps. So maybe I don't need to proceed my my slides anymore. Maybe people know.
This is really great. Yeah.
Okay, perfect. Actually, so yes, that it'll be great. So I'm gonna explain a little bit more how to, and when fear arises, how to manage those things. So thank you so much for answering. That's amazing. So I'm gonna do the lots of questions like this. So if you can put the like you know, the more, if you have the questions, you can put on the chat box, or if you can answer to my questions, that would be great. So now I like to bring up the one thing. So fear. I want you to imagine you need to put your hand in this box, and you don't know what's in it. And if you are told that there is some snake inside, and you need to put the hands in, what do you feel when something touched your finger? How do you feel? Just imagine. You can, if you want to close your eyes, or imagine that there is something like dangerous inside a box, and something touch your finger. I believe that you're going to be very hypersensitive. So you're going to quickly pull out because your fear arises. That's the one thing. And the next one, if on the opposite, if you are told that if something fluffy teddy bear things is inside, and when you put the fingers in, what's going to happen? You are kind of not hyper sensitive, and therefore when something touch your finger, you're gonna be just it's not putting your fingers out, more kind of curious. You are seeking what's inside. You want to touch more. So what I really want to emphasize here is the fear influence your pain experience. All right. So how the pain, the fear influence the pain experience is first of all, this is happen. So when you move, pain comes, and when pain comes is when you don't want to get the pain, so fear arises, and when you fear arises, you don't want to stick in the hand, or you don't want to move. Therefore, you're gonna stay inactive. Therefore, inactivity. And when you're inactive, as a muscle or joint deconditioned. So this is the bad cycle. So when your muscle and the joint is not strong, then you're gonna have more pain. So this is a really bad cycle. So how to move those when the fear arises? The key component, I'm not gonna hesitate to put the result of what I wanna say here, is key point is the gradual exposure to the fearful movement. That's the important things. And this gradual exposure is that you need to be personalized. You need to be individualized. All right. It's not to be the step by step. I always change. That depends on the person. This is very important to gradually expose to the fearful movement. Okay. And so what's going to happen is when you expose to the fearful gradually exposure to the fearful movement, when you move, you're going to have less pain, or you can tolerate. And after that, you're going to fear is a little bit less. Okay, I can do that. When you can do that, the feeling comes is you can do more active, and more active, you get the more, joint muscle get the more stronger. So everyone say that the exercise helps and good for your chronic pain. Yes, there is lots of study shows that exercise and movement helps. However, people, I think, like especially like coming to my clinic, is people do too much or have the higher expectation of I need to do this much, and so they do that, and if next day you feel very painful and you can't move and you need to rest a little bit. And that's kind of a bad cycle as well. So I would do that like a small, make sure that those gradual exposure to the movement, it needs to be personalized and individualized. And then what is the movement you like to do or what you want to achieve? Then those things needs to be small, attainable task or movement. Then you're gonna slowly expose to those movement. That would be great. So for example, when you bend down, you feel pain. You don't need to bend down all of a sudden you touch your toes. Even I cannot touch my toes. Yeah, how about you're gonna do just the bend to the kind of the mid thigh? Maybe that you can do, or maybe some people cannot do. And then how about like bringing the one leg up instead of bending down? So there are lots of ways to kind of like simulate the bending down movement. So gradually expose to those movement, and the key is to tell our brain that it's okay. This movement is okay to do, and reinforce that this movement is not painful. Then gradually increase those movement is the very important things. So I have the one case study is the 44 years old female, and she is dealing with the fibromyalgia. And she came to my clinic for the shoulder pain, but also she wants to increase the activity, for example, walking, but unable to walk due to pain. So she told me that like, okay, I'm gonna do the shoulder pain, but I want to increase the the activity. I need to walk. I need to lose weight as well. Okay, I said like, how about can you walk 3 minutes? And she said, yeah, only 3 minutes? Yes, only 3 minutes if you can walk. And she said, yeah, I can do that. That's not, but nothing, maybe I don't, like that's not enough. And I said, that's okay. You can do 3 minutes of the walk. That's, that's all you need. And then if you are not next day, you see, and not increase the pain, you can add 1 more minutes each time, as long as not increase the pain. Then I ask her how to adapt to our body is more often you do is better than you do the too much at once. So I asked her to maybe if you feel better, you can do 3 minutes in the morning, and you can do 1 minute in the afternoon. So total is 4 minutes. Or if you get better, you're gonna do the 1 minute, 3 minutes, 1 minute in the lunchtime, and 1 minute in the at night, evening time. So you do stimulating more often. So what's gonna happen is body will adapt way much better. But the one time is stress is less. So it's more body adapt much faster. So that's I did. And after 4 to 5 months, she came in and she said, Kaz, I want to say one thing is you told me 3 minutes and now I can do 35 minutes. Oh my God, that's amazing. And I said, like, that's great that you are able to walk 30 minutes. No, 30 minutes, 35. So she was emphasizing 35 minutes, and she does it 3-4 times a week now. And she was very happy about the result, and she continued to increase the time. And I asked her, this is a great example of the, how to kind of smaller exposure, the gradual exposure to the kind of like movement that she wants to do. So she said, yes, please introduce my cases to everyone today. So I got the approval for that one. But like this is the example. So gradually exposing to kind of like a movement that you would like to achieve is very important, but small chunk is good. So first one is this one. So do you have any questions?
I've got one question here, Kaz.
Yes.
That I think it's it's an interesting question. Let me look back here. Where is it, Justine? There we go. So yeah, I'm a long time 18 years of chronic pain patient with fibromyalgia. migraines, herniated discs, and injuries from an MVA
Mm.
at 2021. But also I've recently broken my ankle
Mm.
on the other side of the foot. So heel, ankle heel, and tibia. How do you deal with chronic pain and a new
Mm.
serious pain?
Yeah, so those are good questions. So multiple things, like the ankle, those like injury needs to heal as well. Okay, and so I would do the like you need to pick some exercise that less stress for your ankle. So maybe it's like the pool exercise. If you make sure that the to get into the pool is not like like stressful, too much, not too much stressful. Sometimes it needs to walk to the pool, but once you get into the pool, you can do the not using the like the legs. You can do the whatever, or you can do like anything that is easy for your ankle. Or maybe like a different thing that I can think of is a bike, or anything that like like walking might be tough. I'm in wheelchair. Okay, so that's the different thing. In that case, you could arm things or some sort of the like exercise. Arm exercise, need ankle replacement. Okay, so different. In that case, like a totally different. Like needs to know the situation. What's the kind of like a situation, and then do what you can do. One of the other slide is I put is the some do what you can do. Find out what's kind of like is good to do. They can do. So in the wheelchair, you can do any arm exercise, like, or some movement that the fast you can do without pain or less pain. And then from there, you can start kind of exploring what you can do. And the first thing is that what you want to do in the after that. That is finding the goal is also important. So that like I can relate it to the kind of like a movement that needs to achieve in order to achieve your meaningful the goals, like a movement. Yeah. So needs to be 100% needs to be individualized because the situation is like different.
Right. I really like that that adaptability, like that flexibility, like being in a wheelchair and moving the parts of the body that you can. You're still moving. You're still like getting that circulation
Yeah,
and the muscle building, like, and you still, feel like you're also like doing something when you feel, like you can't do anything.
exactly. And it's not an exercise needs to be done in the gym. You can do it at home. I don't like it personally, like ask the patient to go to the gym because it
Mm,
needs to be, like a more accessible to everyone. If you need to go some sort of a different street, like a place, or you need to have the equipment, then that's the kind of like obstacle to kind of overcome. I
yeah.
needs to be accessible. So always like, do you want to go to the normally gym, or if you want to stay at home, what kind of like equipment do you have? And the exercise or movement is going to be changed, all right? So that's the key, is to individualized and personalized, but gradually still moving and to kind of like get what they want.
Yeah. 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 Sometimes getting to the gym is the workout.
Yeah, exactly. Yeah.
Exactly. Yeah, and some gyms I never want to go to, but anyway. But I love your example of the woman just walking for 3 minutes, like just in her house. I'm
Yeah,
imagining
exactly. Yeah.
around your kitchen for 3 minutes and then slowly build up from there. So accessible.
Yeah, exactly. You don't need to do the fast like having that. Okay, I can do that, and then you're gonna build a confidence and then, okay, I can do art. I can do the little bit 1 minute, 4 minutes, and gradually, you can kind of build the kind of the confidence and a little bit, like oh, pain is it's not gonna be like I will tell you, or the pain disappear or anything, but like I can. People are started, oh, I can do this, I can do that, and start like I think this group, lots of the pain education, that's why I didn't want to touch, but you can tell that, like this is just, pain is the different signal. It's not, doesn't mean that the damaging your body, my body. So you can tell actually to the pain, my brain, that it's okay to move, safe to move. And 3 minutes is okay. Actually, everybody thinks that the exercise is healthy. Exercise is good for our body. So just start small. So that's one thing. And one more things I'd like to add is I think the workshop, another workshop that I attended, I think like last month or something, someone was doing the computer, and when you put, type in the computer is, is a hand or wrist heart start getting, like painful.
Yeah.
So that's the case, exactly gradual exposure. How about if you do the, like just like a small amount, is that still painful? It's not the 1 hour, or it's not even 30 minutes. If you do the like maybe like you can put it at 100 words, is that the painful, still painful?
A little bit
Sort of, and you might need to take a rest. I know this, and you're gonna do it like a little bit. So gradually exposing and doing the little bit some exercise that's related to those things. So maybe gripping exercise or something, and so that gradually, kind of like increasing the time of typing, so that you can manage it quite well.
Thanks. Cynthia asks, are isometric exercises of use?
Yes, those are the great exercise. Isometric is basically like a body is the joint is not moving and you're pressing, but you are using the muscle strength. So exercise. So those are the, if someone is painful to move, you move your joint, isometric is a great way to do some exercise. Those are a great way to strengthening up your body. However, that's also, that's the first step. And the next step is you need to do the different angle and the isometric, because all right. So always like, what's your goal? I first ask, what's your goal? What you want to do? And you're going to do the kind of like a similar movement that kind of lead to the goal.
Got it. Yeah. Thank you for that. That was that first step, just around pacing yourself, doing less than that. See, always seems to be a challenge for human beings. Like 3 minutes doesn't sound like a lot, but you can go farther in the long run. Just pulling it back.
Even you don't need to be 3 minutes. 1 minute is good. Some people is tough. Even though like in the wheelchair, you just did the arm exercise, arm to go around it. That's okay. Is that nothing bad? 1 minute is bad. It's okay. It's okay to do, better than nothing. Even though 30 seconds is don't need to feel like people, oh, I need to go 30 minutes, or I need to do this significant of the time. I'm not sweating. Is that a good? It's okay. It's not, like a fast, maybe just a move, but in the long run, you're going to get there, I want you to change the kind of brain. I can do this. And then you're going to do better.
Yeah. Great. Thank you.
Okay. Do you have any other questions, or you can?
Why don't we go on to the next section?
Next section, okay.
Question. Yeah.
Sounds good. Okay. Next section is, so gradual exposure is the key, always. And then question. So I like to answer this question. Are you doing any regular activities? If yes, what do you do? If not yet, it's just like put the not yet.
Okay. So in the chat, are you doing any regular exercise activity? Yes, walking, kind of.
Yeah. Oh, walking, lots of walking, stretching, Pilates. Yeah, those are the yoga and those things. Not yet. Wow, aqua, walking, yoga, stretching, pool exercise, walking. Everybody seems like active.
Ah,
provided because okay.
right. Okay. Wow, good variety here,
Yeah.
guys.
Yeah, walking. Yeah, that's amazing that people are doing it. So you can do lots of people walking, yoga, Pilates. Those are the great exercise, and so I want to keep those are the exercise. And the next question is, if pain is not an issue, what activity would you like to do?
That's a great question. What
Is
would you
there
like?
anything? Hike,
Hmm.
Pilates as well, weights, tennis, pickleball, snowshoeing, climbing. Okay, hiking. Oh, lots of people hiking. Okay, skiing, dancing. Okay. Full day of activity. Oh, nice. Okay. Kayaking. I like that everyone's answer. So those things, the individual things, and I like that everyone say endurance, hiking, and the walking, and the full day of more activity. People maybe here is more seems that active people, active you wants to do more things. So this is kind of like the is good to kind of so I want to do those things. So what can I do now? Little bit of sometimes like a different type of sports. Start with the different type of sports or activity, and then you can gradually kind of like move towards to the activity that you like to do. So okay, next flare ups is how to manage flare-ups, and this is definitely is important. Sometimes the pain increases and you need to stop. Sometimes my clients, it wasn't that like perfectly every day you can add 1 minute. It's not. It's sometimes flare-ups, and she needs to slow down and maybe not increase. Maybe it goes back. She goes to the 15 minutes and go back to the 7 minutes again. So key is to is a good method is called a mechanical stress quantification. This is I teach in Japan. This is the content from the running clinic. So I'd like to just introduce what this mechanical stress quantification means. So this is a tissue adaptation. Key point is the tissue adaptation. Tissue adaptation is the muscle, bone, even ligaments, and all the all the body tissue adapt to anything. Tissue is adapt. Sometimes we think that our body is a computer or something. So when you stimulate, you're gonna get the weak. And so that sometimes, like if you do too much, oh, it's bad for your back. When lifting too much, it's not bad for your back. Actually, our body is adapt as long as we adapt gradually. Why we do exercise? Because we make the muscle stronger. So our body tissue is adapt. But what's going to happen? This is the kind of like this is the stress that you do every day. That's the blue line. So when you are sitting, you are not doing the much exercise, you're kind of like very low stimulation. Then when you have this green line is minimum stress needed to create adaptation. So when you are thinking that when you kind of like fracture your arm or leg, if you are in the hospital, you need to rest. The stimulation is not strong enough to adapt. So muscle and the bone is, of course, you need the healing, but like muscle gets weaker. That's all right, because you are not stimulating the body to the minimum stress that needed to create adaptation. So this graph is the de-adaptation zone, because like the blue line is not reaching the green line. So muscle gets weaker. So our physio say, use it or lose it. Normally, if you don't use it, you're gonna lose it. So better to use it. And the next one is this is the misadaptation zone, which means this stress is over the red line. Red line is the maximum capacity to sustain the mechanical stress. That means maximum capacity that the tissue can handle, tolerates. So what's going to happen when you have the kind of the more stress and then this red line, you're going to get injury. So you're going to get more painful. Okay. And so you cannot tissue cannot tolerate. So this is the injury. So it's not good. When you pass the maximum stress, tissues maximum capacity is going to go down, and people normally take a couple of days off. Then you're going to do it again, and actually less stress, they get the pain more. Okay, and what we want to do is we want to stimulate the green line, between green line and red line. When you're stimulating the body green line and red line, you're going to slowly tissue get stronger, and you can tolerate a little bit more. Make sense? So you're going to go to get this in between, at least the minimum stress, but not passing the red stress. Okay. So
Kat,
stress.
just not on that slide. So you're pushing yourself just a little above the minimum.
Yeah.
And then you're going back to rest.
Yeah.
And then you're going back just a little bit above minimum, back to rest.
Yeah, no, this one is because every day, this is the, each day, this is the time. So this is the 24, each time, because you cannot keep the, the exercising. You need to sleep and those things. So that's why you're going to go, going up, but slowly, gradually going up. So you're going to do maybe 3 minutes walking was here, 4 minutes, 5 minutes, 6 minutes, all of a sudden you're hitting. All right.
Yeah.
The green line, that's the meaning. Okay. Right. And the minimum, those like mechanical stresses, those stresses coming from 3 components. One is, activity, so exercise, and also daily routine and work. So you need to think about those components as well, especially for the chronic pain. You need to, what do you do the daily, during work, and plus you need to, Kaz said exercise, I need to do exercise, but you need to think about what you did each day. It's not to think about the exercise or those things. And the different activity increased differently to the tissue as well. So this is, for example, Achilles tendon, and the pool running or swimming is not stimulating much for the Achilles tendon. But when you go towards the right, you're going to get more stimulation. So if you do the walking or running, you get the more. This is the more activity, but for example, bending. Just the bending a little bit, bend forward is less stimulation. But when you're going a little bit more bending or picking up something more heavier and lifting, picking up and putting up, that's more different, more mechanical stress. That's the kind of even though, a forward bending, that's different type of the mechanical stress is, the provided to the lower back. So what you want to do is, as I said, the stress needs to be in between green and the red line, all right, to get more tissue, get stronger. And so make sure that we don't want to do too much. That's called the flare-ups and those things sometimes too much. So make sure that also listen, pay attention to the pain during the activity, pain after activity, and the next day is some stiffness and those things. I don't want to do so much flare-ups. Okay, so you need to think about those kind of the pain, But I'm going to tell you after this slide is more important things for the chronic pain. But generally speaking, this is important to gradually increase the stimulation in between green and red so that the tissue gets stronger. Okay. And so listen to your body is very important. However, this is the key for the chronic pain. That was like if you're acute patient, someone said that last time, the ankle injury, and then you need to be very careful of what's your painful and what's not, and stimulating your body within the limit that you don't have pain. Okay. However, this one is for the chronic pain. This red line is not stayed all the time same. Because if you are happy, if you are doing good, work is great, life is great, then this red line goes up. But if your life is not good, having all the time pain and still going through some difficulty, when the red lines goes down. So those things, sleep quality, stress, diet, emotion, those things influence your kind of tolerance to the pain. So make sure that sometimes you feel like you could do you walk the 3 minutes without pain. Let's say next day 3 minutes walking was a little bit more painful and it's very kind of tired. You feel fatigue and feel pain. Why? Maybe you couldn't sleep well, or because sleeping quality influence as well. Or maybe something like stress that you have something bad things happen at work. So each time you can like of course you want to add a little bit more, but you need to consider how you sleep, how you eat, how your stress level and emotion. Those things is very important to think about it.
Right. I just really want to add in here. I don't think we've really talked about this in our movement so much. To, good to get a plan, but also to adapt it if you haven't slept well, or you're having a very stressful day.
100%.
I don't know if we've really explored that. So I think that's such a great point to bring in, to really pay attention to these other things, as well as don't be too hard on yourself that it has to be 3 minutes every day.
100%. Yeah.
Stressed out.
100%. So I give them some like a walking program or some exercise. I always tell my patient that this is the just example. If you have some like sleeping, couldn't sleep, some stress, something, you need to adapt to those things. I said it, like some walking program of 5 minutes. You don't need to do 5 minutes. Maybe you can do 2 minutes first and 3 minutes. You split the half, or 1 minute that day. That's okay. So you need to adapt your exercise schedule, the training program based on how you sleep, how you stress, or maybe I didn't eat much or something. You need to change those things. That's the important things.
Right.
So flare-ups as well. How you do the flare-ups? You gotta listen. I know it's sometimes it is very gray line over listen to your pain, because the chronic pain is sometimes of course listening the pain, then I cannot do anything. If you have a chronic pain, I would say is baseline pain is 2 or 3. I would say, like the 10 is the max, and you have the, 0 to 10 scale, 0 being the no pain, 10 being the most painful you can imagine. I always say depends on the person. If you have the chronic pain 3 or 4, that's the baseline. Then if you don't go up to maybe 5, that's you can still do. But if you go up to more than 5, maybe you need to change. You need to a little bit slow down. You need to do. So those the number is different for the each individual, because like some people same pain, people say 2, some people say 5 or 7. So when you talk to those numbers, I know, okay, this person is putting more higher, so that I how much pain needs to be allowed, those things. So you have the baseline pain, but as long as a certain amount is not increased, you can keep moving, because that's okay to do. Pain doesn't mean that the damaging your body, as long as gradually going up. However, you also need to think about the sleep quality, stress, and diet, and the emotion, and those other components as well.
Got it. Yes.
Is okay?
Yeah.
So-
Yeah. I do have a question, but I'm wondering if we want to do it now or after. It
I
might-
have the humor slide, so I'm gonna just go through those humor slides.
Yeah, and then we'll go
So-
back to the questions. Yeah.
Yeah, so a recommendation is that if you have a flare-ups, maybe temporarily you need to rest. That's okay to do, or different, we call it cross training, a different exercise. So you normally do walking, lots of people doing the walking. Someday you had a flare-ups and you cannot do. How about I'm gonna change to the, like a little bit of bike, or like cycling or different things. I might need to do, normally I do the 10 minutes of walk, but I'm gonna do 3 minutes. But only last for a few days as well, because over the last time, if you do staying too long resting phase, then body gets a little bit more weaker, then you get more pain sometimes. So finding something, what's available for me, what I can do, and start moving within your tolerance. That would be the key. And the gentle cardiovascular exercise, yoga, or yoga is kind of the cardio, or breathing exercise combined. So I saw some last movement the workshop that bring the awareness to your body. That was a good thing. So those are the the cardiovascular, little bit of cardiovascular exercise within your tolerance, and the breathing exercise, and those things would be good to do. And another thing that I would recommend is sometimes flare-ups. It depends on the reason, but the safety reappraisal. So telling you the body that our brain that the pain doesn't mean the harmful or damaging to your body. That is important as well. And the good things here is that one study, I like the scientific literature and the studies. So I added this study is in 2022, British Journal of Sports Medicine analyzed the 380,000 55 middle-aged participants in the UK, and then look at the relationship between physical activity and sleep with all-cause cardiovascular disease and the cancer risk of the mortality. So what happened is the higher mortality risk associated with poorer sleep score and lower physical activity. The highest risk individuals who had both poor sleep scores and no physical activity. So I know to understand that if you have the poor sleep, you don't want to do much, but if you have the kind of a poor sleep, but if you do the physical activity, appears to offset the higher risk of mortality associated with poor sleep.
Oh, interesting.
Interesting. Yes, I thought that exactly. So if you have the, of course, you cannot do too much. You're not going to push or anything. But if you do a poor sleep, but keep not doing it, is not the maybe the solution. Sometimes just do yoga or some Pilates. Do what you can do within your tolerance, and movement would be the good things to do. So our take-home message was both sleep and physical activity are important for your health. But if you are not sleeping well, maybe try at least stay active. Maybe is a good solution.
Mm-hmm.
So that's the one. So if you have any questions,
Yeah, let me go back. There was a question Christine had about in endurance. Where are we? Okay. Yeah, I feel that since I developed piriformis syndrome
Okay.
with chronic pain radiating down my,
Mm.
I am more sensitive to pain
Mm.
caused by overdoing exercises.
Mm.
I before in this, I mean that before this issue, I feel I could recover quickly from
Mm.
overexertion, and now it takes much longer
Mm.
days to recover. Do you think chronic pain issues cause a longer recovery time, or is it my perception of this?
That is a very good question. You need to, individual that realize that maybe a little bit like both in between. You might be a little bit sensitizing it, so you feel a little bit more. But at the same time, piriformis syndrome, that's the nerve-related things. Then you have that kind of like a little bit more, longer time to for the recovery as well. Takes a longer time for the recovery as well. So the key is to not overdo too much. You know exactly, like, oh, I did too much. Then next time, exactly gradually exposure you're not gonna do, or some movement she might need to avoid to do it. And you're gonna do the little bit homework exercise at home and gradually going back. That's my need to do. And so with the chronic pain, she might think it a little bit takes long, then more slowly exposing it to the movement. That would be the great things to do.
Yeah, yeah, to build up the endurance.
Yeah, especially, yeah.
Thank you. Yeah. Okay. Another question here. Can taking your heart rate variability be a good indicator of how much you can handle in a given day or activity?
And those depends how she, like the person is checking the heart rate variability. Sometimes the watch is not a great way because some is not accurate, and sometimes the harness the band is the better version. So it's for the cardio things. I would use the more passive exertion, rate of passive exertion is how much effort you are making. So if, for example, 0 is nothing. If you go 3 or 4, it's kind of like a moderate intensity, and 6 or 7 is getting hard. And those are how you feel. Because sometimes, like same exercise, but you feel more tired than the other day because you didn't, like you are stressed, you are sleeping, didn't sleep well. So you feeling, oh, this is my a little bit more pushing. Normally it's moderate, so 3 or 4, but today I feel, like 5 or 6. Then you're gonna kind of slowing down, like your intensity, and also like endurance is endurance is gradually. You're not gonna go there, oh, I feel great, so I'm gonna do that all of a sudden 30 minutes. You've been walking, 5 to 10 minutes, all right? So all the time, you gotta gradually increase your the time, the endurance part of it. And if you listen to your body, and you might need to, decrease, depends on how you sleep and those things.
I love that you bring in those factors. Yeah, yeah. Thank you. Yeah, just a comment. Yeah, we want to do more, and then we get more pain. It's so frustrating. And I think that is just such a common across the board, that we want to do things and to dial it back. That this is my goal, and to really go slow. Okay.
100% it is. I think it is the kind of frustration of the, I want to go more, but at the same time, listen to your body and, like how much you can do. And if you go to, like if you're not doing too long, then it is not good for your body. So gradually starting it. So To be honest, I'm gonna tell it like in the end of last slide, but like I'm more than happy to, like do the, like 30 minutes free conversation to the everyone, like who wants to start or anything. So I was gonna put the, like slide about if you want to kind of, I know this needs to be individualized. I cannot, like, the kind of like, this is the very general thinking everyone has the different things, and the next one has a kind of like emotion part, and that needs to be, like taken care of, look after as well. So if anyone interested in stay at the end, I'm going to tell you that email address that you guys can send me, and I'm more than happy to kind of take the time to no strings attached to just, like I want to help you as much as I can to, one person, like in the few months, and in the, like, oh, I move better, and that's what I want. So yeah, if that helps. Yeah.
That's so generous, because I think sometimes, individuals just need to know, is this okay? And
Oh, 100%.
And I just want to check something out about myself, because I'm different than, other people.
Yeah, and the different people has a different situation, and the different, like the goals, different like the restrictions. So it needs to be individualized. So
Right.
I think that's why I'm here, if as a physio, to get more functional, but at the same time taking care of the other components as well.
Yeah.
So I'm gonna tell you all the details at the end.
Okay, good. We have one. We probably have time for one more question.
Okay.
Nicole asks, how would you have patients exercise when they have hip bursitis in both hips with sacroiliitis?
And so it depends on those things that are like bursitis, and those things that you don't want to compress, and those things that the movement needs to be restricted as well. So when you do those things, I would I would kind of like how long those like bursitis is having, how long they have those painful. And if you're a kind of more acute stage, then I'm gonna do more limiting those range of motion. But if you kind of like staying a little bit longer, then you're gonna do a little bit of more movement within pain tolerance, and the kind of changing the structure. So definitely I would looking at the range of motion that the person needs to do, the adjust, and what kind of the things activity the person can do. And
Okay.
those things, there is those things that are sorry about it, like it needs to be individualized, but range of motion and the type of the activity is that kind of
range of motion and the type of activity. Yeah. Hip bursitis, as well as piriformis syndrome. Oh yeah, that's painful. Almost a decade. So all walking, walk anyway.
So walking, and sort of kind of walking, then you can do the like a small gradual exposure to the kind of like bursitis. Is sometimes when you keep having the pain, then you're gonna get to the more painful. Gradual exposure, go down a little bit, and you're gonna go gradually adapting as well. So send me the message. That would be, we can talk about more details. And the last part, I'm gonna quickly finish off my last part. Is that okay?
Yeah.
It's the time. I know 2 minutes only, and people have time, other things. So I'm gonna quickly finish. So emotion is also influence as well. Sometimes this is the fear, and this is the anxiety, this is stress, and also sometimes what do you hear, what do you heard about, that is influence your experience as well, and the past experience. All right. If you heard about things about the lower back pain, or people doing it, or or bending forward, or lifting your back, like heavy things is not good for your back. Then if you start hearing those things, then you start having the pain when you lifting the and the heavy things. So what you can do, work with the emotion and those things is that of course like that's the kind of like you gotta change your brain reprocessing. So the pain reprocessing therapy. That's kind of like a more psychological techniques that helps patients to unlearn the chronic pain and the retraining the like your brain and to kind of like this is okay, this is like normal sensation and it's okay to move. And so one of the things is the somatic tracking, maybe like you heard before. And but like a safety appraisal, this is okay, I'm safe to move, this is just a sensation and a positive as positive sensation, and those are the kind of like techniques can helps as well. And the cognitive functional therapy, that's the specific for the lower back pain. And it used to be that when you have the pain, you're really stiff, moving forward is very stiff and get core engaged and you don't want to move, bend forward. But the cognitive functional therapy is, if you imagine if you are kind of fist and making the fist and bend forward, bend the wrist, you cannot bend, all right? So back is the same. If you core engage the core, back is straight, and you try to bend, you cannot bend. What you're gonna do is relax and bend, and the wrist is bend. So when you start moving better, pain gets better. It's not that when pain gets better, it's moving better. Is that the treatment is now once you're moving better, pain get better. So that's the kind of like tied into the like fear as well. So when you're kind of like not engaging, actually I relearned like how to not engage the core muscle and those things to kind of bend down and breathe, those things that's I do. That's the cognitive functional therapy. So try to get rid of the fear and the other emotions. So this is the most important things here. The working with physiotherapists is the kind of like here is the personalized exercise plan, helping you to get back to your meaningful activities. So gradual exposure, or what the exercise you can do to achieve your goal, and also the confirmation that you are safe to move. That's also the people like it, like to have. You are okay. It's not dangerous. You are okay to move this movement, so that like a pain level, like a 5 out of 10, you can move. That's okay. Let's make it stronger. Keep you accountable of the exercise, coming back and to the another exercise, so that looking back 3 months after, oh my god, I'm doing more than 3 months ago. That's happening. So that's the kind of like a good part of it. I do understand that working only physiotherapist is not the solution. So always have a team, like psychologist, the nutritionist, and those things, so that they get the information, what they, we like to help as well. And working in the primary urgent care, lots of the time the social worker is helping for the the financial and those are the things, giving the resource. I'm more than happy to work with. I think like a team is important. Chronic pain is not the one person, is a team. Put the like a good team around you, so that's who can support you, so that you can go to a good direction and of the overcome the chronic pain. And the last one is the case, and this is the kind of emotional emotion was related case. So this is 35 years old. The male he was an avid runner and started dealing with the light calf pain. And he did a lot. So he needs to first stop running. And he did IMS and massage and strength exercise, but didn't help anything. And when you start running, when you feel get better when you stop running, but he start running and calf pain comes back every time, and he was frustrated. And And I checked everything and I couldn't find anything. And like I said, like you're safe to run. It's okay to do because I couldn't find anything that the calf, what causing the calf pain. And I asked the one thing is actually, like he couldn't run for 4 months. So like I said, like so how that 4 months not being able to run affected you. And he was kind of very emotional because he was going through I was like work is very stressful, and I'm getting married, and like actually my condo is flooded, I need to move, and those things. And he was an emotion. Running was the one thing that kind of released the stress, and he couldn't do it. And so I said that like, okay, your calf is everything safe. What you need to do is, he was running a marathon, and I asked him to 1 minute running, 1 minute walk 3 times, repeat 3 times. He was like, what? Yes, 1 minute running, 1 minute walk, even running a jogging, and 3 times, and 4 times, 5 times, gradually increasing it. And I'm refocusing that there is no coughing. I refocusing steps that how many steps he makes during, that's called cadence, during running. And I ask him to running more often and less at the time. That's the like individualized kind of advice. He didn't act just 3 months, 3 treatments over 3 weeks, and he's running in no pain. And he's just recently sent a message, and I did a 50K. So emotion and those things is totally linked with the pain. And having the team and is help to kind of like guide you what you need to do, kind of stuff. So take home message is remember movement as a medicine. So this is sometimes the best medicine you can take. The less is less side effect and those things. So movement is as a medicine, and gradual exposure to your meaningful movement. Start slowly. Start with what you can do and gradually increase. And knowing that you are safe to move, and sometimes like make sure that your doctor and everybody you need to first clarify that you are safe to move, nothing going on. That's the first step, all right? And so that's the important things. And once those things is cleared, then you are safe to move. And one thing, pain doesn't mean that you are damaging your body. Pain is sometimes a sensation signal that telling you about maybe lack of sleep, telling you about the different sensation, past experience, past trauma, and those things. So those like how to manage, deal with those things is very important. And having the team will be the key components, and keep it simple. Don't think it too much, too overthinking, and as much as you can enjoy the movement. So as I said, this is totally free. I work, so I can do Tuesday and Friday. I take my schedule available. So 4 p.m. to 5:30, if that's okay, and I can do as long as the people serve. I'm gonna do. So I cannot do both. So someday this week I can do Friday, next week Tuesday, and those things. But if you can send me the message like kaz@movement.ca, I'm more than happy to arrange those virtual call, kind of like using a Zoom or something, and start from there. Well, thank you so much. I'm a little bit over time, but thank you so much for staying until the end, and hopefully that helped. The information helped.
Wow, Kaz, thank you. I just yeah, I'm so glad that we recorded it because there's stuff to go back to there. That was and that last example. I will wrap up of how you brought in that this fellow had a lot of stressful things happening in life that needed to be brought into the treatment room. He just wasn't just a body. He was, and he was getting married. He's flooded. And that just ramps things up. You're gonna have more pain.
Yeah, exactly.
Yeah.
100%. That's why, he was okay not having the pain. He didn't have any pain when he was not running, but as soon as he started running, body associated running equals pain.
Yeah.
So,
And
and the more stress, emotion builds up, and he couldn't run. And
Right.
when I assessed the normal calf strain versus his presentation was totally different. And so I don't find anything, to be honest. And I said that you are safe to run. He was surprised. What? I mean, no one said that. No, I'm gonna let you run. And he was so happy. But he said that you need to do it gradual. You're gonna hate me, but I'm gonna do it. Anyway. 1 minute running, 1 minute walk 3 times. That's it. Yeah, you haven't run it, so you should be happy. And he said, yeah. And he did it more. But I asked him to run 4 or 5 times those program.
Right.
And
Right.
more often I want to stimulate more. And then he come back and I have no pain. Wow. And
Yeah.
after a couple of sessions, I don't have any issue.
Yeah.
And so that's
It's
powerful. Yeah.
exciting stuff to hear, that clinicians looking at the whole person now. Otherwise, that guy may have never run again unless he was safe. Start small and also, bring your stress level down. Get some good sleep. I also really appreciated the part around the importance of sleep, pain, and even if you're not sleeping, don't let that necessarily deter you. Keep moving a little bit.
Yeah, I think that it is the key things. That's the study shows that is when you have the poor sleep and not inactive, that's the kind of cause the more health problem. So if you cannot sleep, then of course couple days maybe they get inactive, but needs to start moving, all right, in order to do kind of because always a benefit and risk and benefit as well.
Right, of course.
Always kind of it's not going to be at 100%. If you keep resting, is kind of a risk is more getting higher, so benefit is the kind of less, or you're gonna go, you start moving, so that a general health is better, gets better.
Well, I really want to thank you for joining us tonight. It looks like you're going to be hearing from a few people, and I really appreciate your enthusiasm of bringing all of this into the physiotherapy world for people. And really, this is it breaks my heart when I hear of people that are just told not to move or resting, and we know that never gets things better. So we'll be contacting you.
100%. Send me the message, and I'd like to just thank you for the Madeline and the Belnelms, organizing this and having me here, and everyone here participated. I don't know, important time, the valuable time, and I really appreciate all your time and coming here as well.
Great. And for everybody, we have next week, we have someone, Susan Shelnick, coming on to do a Qigong demonstration with us and talk a little bit more about movement. So hope you can join us on Monday. And don't forget, on Wednesday, we have Empowered Relief. That's our 2-hour pain management program. So if you haven't taken it, it's on this Wednesday. So it's all up on the website. All right, everyone. Have a good night. Thank
you so much.
Okay. And we'll see everybody next Monday.
Thank you. Bye.